The International Medical University presents today's topic is about the SCIO. We're going to look into validation verification, evidence-based medicine, a little workshop for you, based on the idea of a meta-analysis, taking a look at different types of studies and how they all come together and what do they show. What is this with the SCIO? Let's take a look at the different history and try to develop an idea of just all the different randomized controlled trials and the case studies and the background science and how this all led to critically appraised topics, evidence synthesis, and systemic reviews as we get to the pinnacle on the top of the evidence chain. Looking at individual clinical experience, patient values, expectation, and the best clinical evidence to get to improving our patient outcomes. Having worked back at the ideas with the gyroscope, I learned about three-dimensional type thinking. Here's the gyroscope that we made that put the astronauts on the moon, helped them to navigate. You see in the middle that little thing that stays solid, that's the gyroscope. And I learned about three-dimensional, and this idea of three-dimensional also applies to electronics as the right-hand rule, and the idea of resistance and voltage, magnetic inductance, capacitance. Now let's look at the medical research validation of the SCIO. And our first real study started in 1974 in Youngstown State University. Here I was taking a look at the electrical reactivity of people, and I took couples. I took 40 different couples, people who were intimate, meaningful others, etc., very, very close friends, and one person was isolated and put into a room where there was a polygraph hooked up, and we measured their brainwave and their heart rate and the EKG, thus measuring voltage and amperage and skin resistance. So we got a real good idea from this polygraph, and we had to change the little bit of the ink, to make it so that it could work. This was the old-fashioned kind. This is 1974 now. Give us a break. And what we did now was we took the other person and in a separate room, put them into a room with a stroboscope that at random intervals would produce a type of evoked potential, very bright light that would flash into their eyes. This produces an electrical shock, a nerval type shock that produces a evoked potential, visual evoked potential in the brain of the person. But could we see a reaction in the other? And yes, there it was. In their verbal guesses, they were very wrong, but in their body electric could feel the stimulation from their person, their friend, their meaningful other. Thereby, we were able to show a type of subspace connectivity by analyzing the trivector. It definitely proved that this was not a verbal process, but it was an instinctive body electric process. This led to development of the Promorpheus. And in the Promorpheus,
and then I met Bill Nelson in Boulder, Colorado.
And here with Bill Cunningham, and working through into Rio Rancho, we ended up with 935 patients in a series of studies. There I am playing golf and at the AAQBT in Rio Rancho, New Mexico. And we started studying the alarm response, electrical alarm response, body capacitance, calibrations, the electroacupuncture procedure, the electrophysiological reactivity, the basic idea of the skin conductance and the body electric in a process back, and this is way back in 1988, where we started doing this. A series of studies were proven, and this studies led to the development of the 510K registration of the EPFX in 1989, electrophysiological feedback zeroid. An incredible advancement to be able to measure the body electric. And we started this basic type of research, and the 935 was enough to get us going. And this led into the FDA registration that still is valid today in the 1989 EPFX. The voltammetric determination, and this was the first book that really led us to the idea that each a biological molecule had its own signature. And by using a voltammetric process, we would be able to measure that type of electrical signature and be able to come out and see this type of electrical process, how it interacts. And then by taking that signature and applying it to a patient, we would be able to see how the patient reacts to that item. Very exciting. This led to the development of the zeroid process. And the zeroid process allowed us to take this tri-vector voltammetric signature that we found for thousands and thousands of different items that were all tested in the laboratory, as we see, and then be able to give that to the patient electrically and see how they would react. This started us into a process leading to the QQC development, a separate machine from the SCIO. This is a machine that allowed us to measure the voltammetrical electrical signature of different items. This led to the development of a book known as voltammetry research, where we found that this was a three-dimensional. Remember the three-dimensional ideas. From here, we started to expand, and we did studies in England. Here at Camelford, we did one of the big studies, where there was an aluminum toxicity exposure, and we analyzed the patient's reactivity, their electrical physiological reactivity, and found that this aluminum produced at a premature aging.
Over 200 people studied in England, and then 15 years later, when a Hungarian toxic spill happened, we were able to do a comparative meta-analysis. And lo and behold, it was very, very similar reactions between the Hungarian and the English people having been exposed to toxic aluminum exposure.
And then we moved to Kiev to study research and cancer research with the EPFX. Very exciting to be able to show this here at the Kiev Institutes, World Health Organization recognized hospitals. And then the Royal Society of Medicine, 1992, where we all got together for a 3-day period and presented incredible studies on this technology, the body electric and the electrophysiological feedback zeroid. 1992 at the Royal Society of Medicine, London, England. Very exciting as we see all this coming together. Started doing work at the Semmelweis University Hospital, and we started finding out different things that we could do. And in the hippocampus research, another 1,000 patients was seen as we analyzed a host of different types of studies to determine about how we reacted to different things, and also ideas of the basic body electric. So this was done in the early 90s, and it led to a presentation of our papers in 1995 in Singapore on a whole study that we did with HIV patients in the hospitals. And an exciting thing that we were able to find out that there was indeed an electrical profile, and that we were able to show that the type of profiles was able to be seen. Here at this hospital, we were able to show a reactivity profile for cataracts. Very interesting. And a host of other different things. And here's the hospital I worked at, where I tested all the AIDS patients in Hungary. And I was able to see a definite electrical reactivity pattern. This led to the development of different other things in finding the zeroid reactivity. I was nominated for the Nobel Prize for this work by a group of people from the Ukraine. I gave presentations at many different places, and we started developing more and more of the research until I was hired as a professor at the Semmelweis Medical University, professor of natural medicine in 1996. This led to our European registration, which was for transcutaneous voltammetric electrical potential. Thereby, it led into our registration here in the European community. Another whole series done by a different group of people was in Hawaii, that of birth trauma, and how they had used the QXCI, formerly known as the EPFX, to find ways of making the birthing process easier. And a whole host of different studies came out of this. We also saw a host of many different other things that came in, and all different types of studies, because many doctors were now jumping on board to do more work in Spain and in Germany and France and all over the place. Here was work presented from South Africa. Work that was done all around the world. And from 2002 to 2010 at World Congresses, we produced research done from Ghana, research done all over Africa, all over. Here's a research project done by Dennis Johnson of the NBA, working with some of the San Antonio Spurs. We presented many different types of papers all around the world, a host of different Congress presenters, as people started to validate and verify by doing research and doing studies. Here from South Africa, the SCIO is 80 to 95% accurate. Hungarian doctors, Romanian doctors. Studies, studies, studies. Many of them double-blind, many of them published in peer-reviewed medical journals. We started a peer-reviewed medical journal in 1996 and were able to then get these items into the publication, into a peer-reviewed publication to help the world. Then measuring in VARHO, we were able to see that there was voltage reactions that came from the heart, and just how we could blend this all together and start to get an electrical profile. Here's a study done in Germany. Host of different studies to show that we were able to do. Now, through 2007, we had over 2,225 medical supervised therapists, over 100,000 patients, 300,000 patient visits, 220 different diseases, all evaluated, and ended up with about 70 different papers that came out of this that showed just how well that QXCI SCIO now, how it worked in a host of different types of diseases. And we were able to show in this large-scale study, one of the largest biofeedback studies ever done, just how incredible this technology was. People sending us data from around the world, and then we did many, many double-blind studies, because here's research done from Canada in measuring the different ideas of the TVEP, transcutaneous voltammetric evoked potential. We worked with AC Milan, and they were able to cut their injury rate by 91% in the studies that we did with them, helping them to win championships. Novak Djokovic, we were able to do work with him and improve his game, and a host of other things to be able to show. I did a presentation at the Hungarian Sports Academy to be able to show all the work that Igor and all the other doctors were doing was so valid and so validated, verified, substantiated. Then in 2008, we were invited to the Chinese Olympics to do studies. Here with the Crown Prince of Dubai, we saw work that was done on horses. Novak Djokovic worked intimately with us. And through this 2008 paper, it ended up with a complete presentation that we did in 2011 to show the incredible validation verification and how we had shown that there was ability to lower addiction, that there was ability to touch and improve the body electric. All these different research papers and opinion papers coming together that helped to show just the power and the scope of what we were doing. And the TVP research starts to blossom and grow. Medically tested, medically evaluated medical research papers from medical doctors all over the world being presented to help validate, verify all that we're doing. Blood analysis studies, blood motility studies, TVP, reactivity, validity studies. And I encourage you to go to the journal to read all these incredible studies. It's way too much for us to present It would take a small truck to present all the studies in their complete detail. But you might want to get a book and be able to look at just the summary of some of these work. And what you're going to see is in this meta-analysis and development. And then in 2012, we wanted to challenge our ideas even further, showing that oxidation could be increased, showing that we could decrease addiction level, that we would be able to deal with the sports performance by making people stronger, they could hold their breath longer, increase body osmosis, decrease allergies, measure allergy sensitivity, measure emotional reactivity, and a host of different things coming together and helping to deal with injury and pain, developing ideas that would help, stimulating eye-hand coordination. In other words, we were able to show how we could make people 5% better. All of these different studies brought together, giving us this wide range of background, medically tested, double-blind challenged, peer-reviewed medical journal published, ISSN journal rating, leading to the development. And in 2013, we put together the American papers to be able to show that not only had we done work in Germany, done work in Hungary, done work in Africa, but in the American studies, we were able to bring that together. We're also able to show how the device could help stimulate, deepen meditation states to help bring people to enlightenment quicker. Host of different studies shown in many different types of journals, not just in the one journal that had the most, but in journals all around the world, being able to show the complete validity and verification of these things. And in 2013, we came together to also show how we could increase osmosis, which would increase oxygenation, which would increase muscle strength. And the whole history of the SCIO biofeedback comes together. And the results are in. The SCIO really does work. And what we're able to now find is that who recognizes these journals, who recognizes this? This is all done at the University of Timisoara, University of Ayashi. Other universities now have accepted these textbooks as medical certified university textbooks. Certified university medical textbooks that now over 100 textbooks, all with different studies in them that have now made the complete validation verification. Regulators, governments do not determine what is or is not medicine. That is determined by the medical universities that do the teaching. And now that these books have been credentialed and accepted, this is the highest form of validation verification that you can possibly get. In the World Health Product Rating System, we find the highest rating given to the SCIO Eductor QXCI EPFX technology, the highest rating of 11. So here we see, after all of these books and all of this research, that what we started back in 1974 is now coming back together again. All of these studies having been done with proper ethics committees, proper legality, all the I's dotted, the T's crossed. But now it's time to do the repeat of the original. And lo and behold, when it's done here versus placebo, we can see the data. as now we need to reproduce. And in 2013, we've reproduced that study. We can see clearly that there is a subspace link beneath the words. The words do not do this correctly, but we have a subspace link beneath the words that is connected and can be measured by measuring the voltammetric signature, the VAR-HOPE, the voltage, amperage, resistance, oxidation, hydration, proton and electron balance. And by doing this, we're able to now help people and validate, verify, complete in our art. This little meta-analysis has come together to help us understand just why all of this research, what it wants to tell us, and what it's going to tell us is that the SCIO is validated and verified way beyond anything else in medicine. And that all the little challenges and the little slurs that have gone on have just been from drug company people who don't like new things and don't understand the ideas that there really is a body electric. And what the body is made of is atoms. And all atoms have electrons in the outer state. And these outer shells of electrons repel each other, so no two atoms ever touch. What holds everything in position is electromagnetic energy forces. And that's really what we are, as we've told this over and over and over again. And putting all of this together, we now come up with the true idea that what we are is an electrical being. And by measuring the basic forces of our brainwave and our heart rate and our voltage and our amperage and all these different potentials, as we've shown throughout all of the different research, we can get a deeper insight into the body energetic, the body electrical. And thereby we can able to interact with it and help to perfect it. A new type of medicine, validated, verified, and comes together to help to bring to you who recognizes these journals, who recognizes this. Here's a group of the doctors that have worked with us. And you can see here that these doctors.
Numele meu este Meze Iosif, sunt președintele fondator al Asociației Transilvane de Medicină Integrată și Cuantică și de asemenea fondator al Centrului Medical Tonchean din Sighișoara. În prezent mă ocup de activitatea de medicină complementară și integrativă în calitate de vicepreședinte al Asociației Patronale Române de Medicină Integrativă, având ca scop promovarea medicinei alternative sub forma medicinei integrative. Încă din studenție m-au preocupat fenomenele energetice ale fiziologiei și patologiei umane, motiv pentru care am ajuns
Konzept und Entwurf, Gutachten über das Gerät, etliche Aufsicht und Beitrag haben selbstverständlich auch ihre Preise.
My name is Dr. Eductor. I'm educator on postgraduate study organized by SCIO International in collaboration with University of Timisoara Faculty of Medicine.
Bună ziua, sunt doctorița Codruța Băcean. Sunt foarte mândră că fac parte din stafful Centrului de Biorezonanță Dr. Băcean din Timișoara. De data aceasta suntem de asemenea încântați că în colaborare, Centrul nostru de Biorezonanță, în colaborare cu firma SCIO International din Oradea și cu Universitatea de Medicină și Farmacie Victor Babeș din Timișoara, am organizat acest curs de neuroelectrofiziologie și biofeedback.
Guten Tag, mein Name ist Matthias Heiliger. Ich bin Facharzt für Gynäkologie und Geburtshilfe und medizinischer Berater der Firma Wellness Trust AG hier in Kreuzlingen am Bodensee in der Schweiz. Ich möchte Ihnen heute das Produkt SCIO vorstellen, ein System aus der Energie- und Informationsmedizin.
Since Dr. Nelson spent the 3 years with me every day teaching me how to use the machine. I do use it in a much probably more basic way than a lot of the other practitioners. I focus on three major areas of health, and it is to detoxify the client, to rebuild major organs, and to nutritionalize them. And in that process, because of Professor Nelson's homeopathic repertoire, I use the homeopathic remedies he created in Denver to carry on the work of the machine during the session.
The 25 years of allopathic practice have taken me down several roads, but it was my need to obtain more knowledge about the human body and how it actually works that led me into the energy field. Looking at the area of quantum physics have brought me a long way. Give you a word that could change your thinking and at this moment change your electrochemistry, and I might get a contraction of one or two muscles, whether it is visible to the world or not. Something within you is wired for this feedback. And so with biofeedback, I'd like to, at this point, introduce Naja, who is a patient of mine on biofeedback.
Sunt doctorul Băcean Aurel, sunt neurochirurg, sunt cadru didactic la UMFT Timișoara, la Institutul de Medicină, unde predau anatomie și sunt profesor expert în biorezonanță la imun și mă ocup cu biorezonanța de mulți ani.
Are all working to help bring you the highest form of technology. This is not one person working. This is a host and a team of doctors working for all those years who have brought this together to show you today the SCIO, the Eductor, the EPFX, all this technology all coming together, validated, verified, substantiated, and our meta-analysis finally shows us that we can measure the body electric, increase the body electric, and help patients to deal with all different types of diseases and reduce their stress. A new idea, a simple idea taking biofeedback to its end limits to be able to feed back electrical data to the patient and help them to improve themselves.
Hundreds of articles being published, so many medical doctors doing double-blind, peer-reviewed medical studies, hundreds of thousands of patients in these studies, all getting incredible validation, verification of the technology.
This is Desiree Dubonnet. I hope you were entertained by our little meta-analysis.